Neuropathy, so nerve, and pathology, disease. So neuropathy is basically dysfunction and disease showing up in the nervous system. Now, when we talk about where I focus on with a lot of patients, because it's really related to diabetes, is peripheral neuropathy. And peripheral being out in the periphery. So it typically shows up in the feet and the hands. And how people are going to experience it is it's going to show up as numbness, tingling, pins and needles, pain, these types of things. But in a simple way, it's basically the nerves dying, breaking down. Now, what are some of the biggest causes? There are dozens, if not hundreds of causes, depending on how you look at causes. But some of the biggest ones, type 2 diabetes and insulin resistance. We're looking at nutrient deficiencies, sometimes medications, certain cholesterol medications and other medications can actually lead to the symptoms and issues of neuropathy. So there's a lot of other factors. There's autoimmune diseases. People have gone through chemotherapy. So those are some of the most common causes. But then there's a lot of nuances in between that. And whenever someone shows up and they say, I have neuropathy, or I have high blood sugars, or anything along those lines, what they're really telling me is the symptom, and that's all that means. I have type 2 diabetes. From a diagnosis symptom standpoint, all that tells me is you have unregulated high blood sugars, or type 2 diabetes. You have insulin resistance that causes high blood sugars. You have neuropathy in your feet. It just tells me you have some type of dysfunction or pain symptom showing up in your toes, affecting the nerves. Numbness, tingling, balance issues, pain, hot, cold, this type of stuff. So the real shift is we got to understand what are the causes. We have to do testing. We have to do a thorough health history to really understand how are we going to help this patient with these symptoms. And that's what's going to help us get to the root of it, as opposed to, oh, you got pain in your feet? Here, take this pain medication. Take this nerve suppressant medication. Guess what? We'll numb it. You won't feel it anymore. Send you back to your day. And that's about what goes on. So yes, it's some scary stuff for people. It's extremely painful and annoying and frustrating for people, especially when they've exhausted their medical routes and basically the doctors say it's progressive. This is only going to keep getting worse, and we'll give you some medications to help alleviate some of the symptoms and pain. But I think when people are on that path long enough, they start waking up. The internet's helping. Why is this happening? What can I do about it on my end? I feel like there's something else there other than me just living with it, taking a medication to alleviate the symptoms, but ultimately looking at a path of peripheral vascular disease, worsening of symptoms, and let alone many cases, if not helped, amputation. So tons of causes, and it just depends on what is creating the symptom. I want to give you an example about that. So people will come to us for peripheral neuropathy. They might see an ad, they might see us at a local lecture or online webinar and go, I have numbness and tingling in my toes. And they go, let me follow up, let me get an examination. But when they come in or we meet with them and we do an examination, we end up finding it's not peripheral neuropathy, it's radiculopathy. And you go, whoa, what is that? What is radiculopathy? It means it's radiating from something else. So in this case, it's something in their spine that's causing a little degeneration, a lot of times in the low back. It's irritating the nerves that flow out of your lower spine down your legs. And it's radiculopathy radiating down to the toes, creating symptoms very much like peripheral neuropathy. Now, a good point to understand about that, there is so much overlap in symptoms. Diabetic neuropathy can create numbness and pain in the toes. Radiculopathy, a spinal issue, could lead to numbness and tingling in the toes. Nutrient deficiencies, where the nerves don't get the water, oxygen, and nutrients that they need to function properly, could cause numbness and tingling in the toes. And that's why it's so important. If you really want to make a meaningful difference, you have to understand what's causing it. You can't just go, "Hi, nice to meet you. You have numbness and tingling in your toes? Well, I have a pain med that will just completely block your sensation of any of that negative experience and send you on your way." Except they don't tell you side effects. You're not just numbing the nerves in the toes, you are numbing the whole brain and nervous system, the master control system. So, of course, it's going to come with some other issues. So, just some of the points around what is peripheral neuropathy, what are the causes, and I wanted to just interject some insight into just because you have a diagnosis, the diagnosis is not necessarily explaining why. This is a big topic no matter how you look at it, because depending on what research you look at, 30 to 40% of peripheral neuropathy cases is from a diabetes cause, a type 2 diabetes cause. So to answer the question about how does type 2 diabetes really create neuropathy in this sense, we want to look at this more individually. Generally, yes, I'm going to say a few things, but for each patient, you got to understand what aspects of this type 2 diabetic is leading to their neuropathy. So for all type 2 diabetics, you could say insulin resistance. If glucose cannot get into the cells to produce energy, the cells will wither and die and become dysfunctional, right? So when we talk about that, generally speaking, insulin resistance is a huge factor that can affect not just peripheral neuropathy, but really no symptom a diabetic has surprises me, because every cell in the body needs to get their energy. And insulin resistance will block each cell's ability to really function properly, take in glucose, make some ATP, some gasoline for the body, using the little mitochondria of the cells. And if that gets blocked, of course, cells in the body, nerves, dysfunction can happen. Now, why I'm saying it, because it's very hard to give you a sexy answer when I'm such a customized practitioner, knowing that even when we say diabetics, when we actually test diabetics, yes, they all have blood sugars, yes, they all have insulin resistance, but they all could have very different underlying root causes, which then thus allows the diabetes to progress and thus the peripheral neuropathy to progress. Another potential reason why diabetics get it, they have a lot of chronic inflammation that can break down blood vessels and peripheral vascular disease. They have nutrient deficiencies. But I want to simplify this. Anything that will affect good, healthy circulation and blood flow and hurt the nerves. And if you just get that right, you not only can have a better idea of what's causing it, but also what the treatment should be. Can hardening of the arteries and cardiovascular issues and everything that we talked about, eating high sugar diets, being stressed out all the time and getting plaquing of the arteries, would that affect blood flow? Absolutely. And that's exactly what can happen with a diabetic. If you don't have the nutrients coming into your life, into your nutrition, then the blood circulating all those nutrients is not getting it to those toes and hands, and thus the nerves are not getting what they need to even function. So I'm painting a picture here. How about sedentary? You're being sedentary. How about an injury? What if you got a low back injury? Could that cause pins and needles and neuropathy in the toes? Absolutely. So when you understand how the body functions, even at the most basic level, there's my toes. I know that blood's got to get there, oxygen, nutrients, and water, it's got to get down there. And I know that nerves have got to go because the nerves is what controls everything. See, now I can start having a framework on, well, anything that affects blood flow and nerve function could be the cause of that. And then once we identify it, that's what our treatment program is going to be. How about we give you some therapies to have nerve stimulation? How about we give you some nutrients and other therapies to promote more blood flow or blood vessel dilation? The blood vessels open up, they get more flexible. How about we get you some exercise, get that heart pumping, which is for the purpose of circulation and blood flow.